Hello, my name is Tae-Geun Gweon. I'm an associate professor at Catholic University of Korea. I am honored to introduce our study, Safety of Cold Snare Resection Techniques for Removal of Small Colon Polyps in patients with clopidogrel and aspirin, a considered prospective multicenter study. Use of antiplatelet agents or anticoagulant may further increase the risk associated with bleeding after polypectomy, as indicated by various studies. The management of antiplatelet agents is contingent on the bleeding risk for endoscopic procedures and the potency of the drug. Aspirin is recommended for use without interruption during polypectomy, despite it being considered a high-risk procedure for bleeding, while guidelines advocate for the temporary interruption of clopidogrel prior to polypectomy. The US and Canadian Joint Committee guidelines published in 2022 refrained from making a specific recommendation owing to a lack of adequate data. The cold snare resection, CSR technique with or without submucosal injection can remove polyps without use of electrical energy. CSR is recommended safe for bleeding complications than other polypectomy techniques involving electrocautery. We aimed to investigate the bleeding complication of CSR for small polyps less than 1 centimeter in clopidogrel users by comparing them to those in aspirin users. This multicenter prospective study was conducted at 5 university-affiliated institutes in Korea on behalf of Intestinal Tumor Research Group of Korean Association for the Study of the Intestinal Diseases, CASIT. We defined continuous use of antiplatelet agents as interruption of drugs 3 days or less, considering the effect of duration of aspirin and clopidogrel. The primary endpoint was delayed post-polypectomy bleeding. Polyp resection was done using cold snare resection. After polypectomy, intraprocedural bleeding was observed for 2 minutes. The grade of intraprocedural bleeding was categorized into 4 groups. 2 minutes after polypectomy, hemostasis was performed for major bleeding that did not decrease or increase over 2 minutes. Immediate hemostasis was performed for blood spurting, and an increased amount of bleeding or size of protruding vessel was observed over 2 minutes. Hemostasis was achieved using hemoclips. Thermal or injection therapy was administered at the discretion of the physicians. Immediate bleeding was defined as grade 3 or 4 bleeding requiring hemostasis. A total of 263 patients were included. The number of resected polyps was 509. The mean age of the patients in the clopidogrel and aspirin groups were 67.9 and 64.4 years respectively. The rate of coronary artery disease was higher in the clopidogrel group. Here are the results of polypectomy. Delayed bleeding occurred 1 case in each group. The rate of delayed bleeding was 0.8 and 0.7% in the clopidogrel and aspirin group respectively, meeting the non-inferiority. A notable strength of our study is the detailed analysis of intraprocedural bleeding. which investigated the risk of immediate bleeding using per polyp analysis. Hemostasis was done in about 20% of total polyps. The risk factors for immediate bleeding, which required hemostasis, were female, end-stage renal disease, submucosal injection before polypectomy, polyp size 5 mm or larger. Clopidogrel was not independent risk factor for immediate bleeding. In conclusion, cold snare resection is a safe technique for the removal of small colorectal polyps in patients taking uninterrupted clopidogrel and aspirin. I thank all the co-authors and corresponding author Hyun-Gun Kim at Suncheon University of Korea. Thank you for your time watching this interview.